So why own your own business? The truth is, when you get to be the captain of your own ship, you get to choose how you serve your clients. You get to choose how much value you provide for the people you do business with, and you choose the quality of your product. You make a direct and tangible impact on people's lives. And because of this, there's no limit to what you can achieve, how far you can go, or whose life you can impact. Owning a business takes guts. You take risks and you make decisions. You put it on the line. You create the future that we get to live in. You change the course of history. You improve and innovate the things around us, and you create opportunity for the next generation to thrive. Keep after it.
Hi guys, this is Tim in Tacoma, Washington. Going to be doing an interview at the Alliant Physical Therapy Center with Tim Sobie. Tim, thank you for being on the show.
Oh, thank you so much.
So Tim, tell us about how this all started. Why physical therapy out of everything you could do?
Well, there's an addition to that. Alliant Physical Therapy and Intergral Medicine is the other part, because I have a psychology PhD in neurology of chronic pain. And so the whole idea of mind-body medicine, not all in your head, not all in your body, but both, is just the integrative aspect of how they're one and the same thing, just separate sides of the same coin, or maybe the same sides of the same coin, rather. And so physical therapy came out of a stepping stone to maybe looking to go to medical school. But when I got involved in hospital affiliations and saw a lot of the involvement, I thought I'd postpone that and look at some other fields as well. And a lot of what comes up is just being introduced to experiences is what guides my education.
So school, medical school, or thinking of medical school, then physical therapy. Where did the psychological aspect of pain and health come into all this?
Well, there's an abundance of continuing education opportunities in physical therapy. Most of my class gravitated towards sports medicine as a specialty. I went out and visited individual practices at the Health Sciences Center and outside the Health Sciences Center in communities. And there are private practitioners that would work with like temporomandibular joint problems and headaches and chronic pain in that way. There were others that were maybe, I went to the burn unit over at the hospital center. I went to maybe a hand therapy specialist. So I made my own curriculum, basically, rather than go into an established specialized curriculum. And faculty was okay with that, and that worked out. And I got a broader exposure of possibilities there. At one moment, I'm from Michigan originally, but I happened to go to the University of Oklahoma Health Sciences Center. And one of the practitioner groups indicated that this Institute of Physical Art out of California was doing a course in Tulsa, and they emphasized this idea of this thing called Feldenkrais method. They heard a lot about it. They weren't really aware of what it was about, but they knew it was something good. And I didn't know what to expect. And I remember just being guided through these sequences of movements, laying on the floor and feeling my lumbar spine go like this on one side of my body. And I thought I had structural sway back deformity, and
which is not
in
good.
my spine.
I'm assuming which is
yeah,
not
exactly.
Good, yes.
It's kind of one of those medical terms, meaning that your posture is too arched in your back, and maybe it's something that needs to be corrected through strengthening exercises, maybe core exercises. Interesting how that will follow up. But then we did a series of movements where we actually imagined a series of these movements without actually doing them. The same sequences, same order, but imagining the movement. So maybe your hands behind your head, the other's on your knee. You're imagining bringing your elbow towards your knee, having your eyes look at some opposite sequence of knuckles, noticing different ribs, noticing maybe different ventilation spaces. It's more about quality of engagement than repetition. And after doing that, then my other half of my lumbar spine went boom. And it was all kind of a drug-like, surreal experience of these slow, guided movements that driving home after that, it almost got canceled because of a snowstorm even, in Oklahoma, where everybody's just not ready for that. But anyway, driving home, I was just saying, wow, there was something about that. There was something about that.
And this was way before you started your practice, way before you started all that stuff.
This is my first year of employment after college for a private practice group.
Nice. And was the private practice group you were with, were they doing stuff like this? Were they doing the mind-body combo?
They were outpatient orthopedics at least, and a good wide distribution of caseload, neurological conditions as well as stroke rehabilitation and orthopedic extremities, knee and hip replacements, and forearm and hand problems and back problems.
So a little bit, but not very much. Would you say?
In fact, what I was doing was kind of at odds with what the standard of routines tend to be, and that kind of continues to this day.
So you went from working for somebody to moving up here, and when you moved up here, did you start your business?
Oh, I began an employment series with another private practice here in Washington, and there was an affiliation with the Madigan Army Medical Center at the time when it first opened. I was a civilian contractor, department director at Madigan Army Medical Center for the outpatient non-active duty and dependents, and that was for a year, and then I ended up working for a registry.
Well, I was going to say that with everyone that you went and saw, is anyone doing what you do right now?
I really wish there were more physical therapists engaged in what might be titled as the sensory side of physical therapy. You look at a majority of outpatient clinics, you'll see that it's outpatient sports medicine kinds of things. And they're catering to sort of an audience of persons or a customer base that is maybe, I get catalogs from an orthopedic supply group out of Minnesota, and you look at the catalog, you'll see all these lean persons just touching their toes behind themselves and angling their body in yoga poses. And that's not my customer base. That's not who I see. That's an exception.
Yeah, totally.
And so a lot of the fitness model, and fitness is important, but it shouldn't be the first line of intervention for persons who maybe have a serious trauma or a serious medical disorder.
So you started your own practice eventually. Now
Yes.
And then how was that? I mean, did you already have a large customer base? Was it a very big education process?
Fortunately, I had a management intern training with this nationwide corporation out of Texas when I left my first employment, and we were department directors in hospital systems. But the whole management training experience helped to at least engage the idea of going into private practice. More importantly, though, is that a lot of multi-chain clinical operations, especially if they're more corporate, will tend to want to have a protocol of duplication and consistency, which isn't a bad thing, but there's an impetus for every clinician to kind of do the same expectancy
totally.
that can be carbon copied for the next employee or the next trainee to do what the practice does. It's not true for all practices, but the more corporate and the more multi-chained involvement, the more that phenomenon of uniformity of protocols will tend to occur.
Totally.
So I'm more of a chef and artist and with scientific influence than a line cook, say.
And how has it been with your customers as far as in getting them or your clients and getting them and actually educating them? Because I mean, this is the first time I've heard about holistic medicine and PT. Usually I hear about one or the other.
Oh, right.
Not both of them together.
I guess when I first put my shingle up, and you'll see shingles aren't so, by shingles I mean hanging up your own sign, but physicians in primary care, it's a challenging thing for them. Hospital systems tend to be owning medical practices now. I guess the strategy I use is if I could take an unknown therapy that seemed unusual or different and have it be contained in a contrasting Old Town Professional Center down by the waterfront, and I at least got a good lease rate and everything too for down there at the time, right? That could be a contrast. It could maybe at least build in some, what's the word I'm looking for in business? Credibility, kind of a credibility aspect. I would say word of mouth is kind of what worked best for me. and then I changed the brand to Alliant maybe partway through, reading the writing on the wall that the owners of that facility were expanding their civil engineering firm, and that my space might be next. And of course, that's what happened. When I woke up one Christmas vacation with my now wife, we were at home. I said, I'm going to lose my practice space, and. But we came across this space here at 201 North I Street. It had been one of the first, I guess, grocery stores in Tacoma before an appliance store, and then an architect firm, and then a nonprofit Youth for Christ. But the idea of renting versus purchase was, brought about. We decided to make a purchase.
Okay. Oh, so you purchased this building.
Yeah, so we did this whole remodel. Before we were married, my wife and I. That's a premarital test, So this is all new concrete that you're on with a lot of, bio-green materials, this marmoleum floor, low VOC paint, recycled window panes from the old building are outside. So we retained as many features as we could, and we brought warm colors in that are maybe southwest and warming during our gray winters. So it's
and our gray summers.
Our gray summers. When is that going to happen? At least today's a better day.
Today is a better day. Thank goodness.
But it's so we wanted an environment that would be welcoming, but not too clinical, not too white cloak clinical.
Yeah, totally.
And part of the model is clinical care, but outside of that, maybe a fitness center for the mind, maybe a replenishment center for the body, where workshops and urban retreats could happen.
So, in closing here, Tim.
Yeah.
What is one little piece of advice that you can give the people watching of basically how they can help themselves a little bit? Just something simple.
Okay.
Because this is pretty interesting category.
And you're alluding to persons with medical functional problems, or the business aspect?
We'll do both.
Sure.
Let's do someone who just has some chronic pain somewhere.
Okay. Yeah, so chronic pain is a complex phenomenon, and it's multifactorial. And the knowledge of pain science, you could Google pain science or pain science neuroeducation or therapeutic neuroscience education. Researchers like Mosley are interesting to read on YouTube or be with. But the idea that there's an injury, body tissues heal within 3 weeks to 3 months, depending on the severity, but chronic pain lasts for years and years.
Yes, it does.
And what's known as neuroplastic changes in the brain doesn't mean it's all in your head, but there's a body representation, a body map representation in your embedded throughout various levels of the brain that migrates away from movement control areas and over toward limbic system protection, anxiety, worry, fear, sense of self, being put together, gets fragmented, because a lot of things get lost from that experience.
So what can someone do?
So what can someone do to work with that? I would say, there's a medical surgical model that has its necessity, but there's a big world between pharmacy and surgery that's largely untapped. And even there's subdivisions within complementary alternative medicine. I don't think reducing things to subluxation or blocked energy or something is the thing. A person who has chronic conditions needs to have some active self-engagement into themselves for sustainable change. And in an environment that feels nourishing to meeting that person where they uniquely are individually, and not coercing them into maybe, one size fits all. So I would say shop around and review alternative methods you might not have heard of. Just because you haven't heard of them, it might mean that it's not beneficial. It just means that maybe there's a higher bar of training that goes with it, which I think Feldenkrais' commitment is part of that. And other chronic pain, let's just say persistent pain is a nicer word for that.
Chronic pain, yeah.
Yeah.
Okay. So with the business side, one little piece of advice for business side, because you basically kind of cleared your own trail. Like you did something not you did something not super common. So, and then I'm sure you've had some flack from it, or some people saying this is hokey or stuff like that.
There were transition years where that was that way. 2 books by Norman Doidge, Brain That Changes Itself and The Brain's Way of Healing, are all about this phenomenon of neuroplasticity is a new neuroscience. So that helps at least get credibility in the medical field. A lot of physicians with primary care realize they have little time to spend with a patient. So, we have 45 minutes to an hour to work with a person, and we work with their process, So yeah, I mean, the environment I think has gotten better. But if you're doing something that's maybe pioneering or original, and it starts with a few satisfied persons to cultivate the word, and one challenge is how do they translate what is so different into words that are easy to know. But maybe if people witness and see that a person's moving better and feeling better, that helps.
Well, Tim, you have a ton of knowledge in this space. I can tell you definitely love it because you study this thing like crazy.
You can sense the enthusiasm, yeah. If I didn't have the enthusiasm of the experience, I wouldn't have gone to the science part of it.
Yeah.
The PhD wasn't my plan in life. It was something for beyond myself, to get this work maybe
to get
more recognized.
And to get it out there. Well, hey, Tim, thank you so much for
appreciate you
being interviewed today.
All right, great.
And good luck with your business.
Yeah, and life as well.
All right.
Thank you.
Thank you.